You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from benchside to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast.
Hello, and welcome to the Oncology Nursing Podcast. I'm your host today, Laura Fennimore. I'm the immediate ONS past president, and today I'm joined by three fellow ONS leaders to discuss how the future of oncology nursing looks in a rapidly evolving healthcare landscape. We'll be presenting this topic at the ONS Bridge in mid-September. So first up, our ONS member, Anne Ireland, is the Executive Director for Community Nursing Practice at the City of Hope National Medical Center in Duarte, California. Anne is a Director at Large on the ONS Board of Directors and is also the Session Coordinator for our ONS Bridge presentation. Thanks for joining us today, Anne.
Thanks, Laura. It's great to be here with such an awesome team and some dear colleagues and friends, and I'm really excited to be chatting with you all today.
Great. So also with us today is ONS member Kristin Ferguson. Kristin is a clinical operations manager and nurse manager at MedStar Georgetown University Hospital at the Lombardi Comprehensive Cancer Center in Washington, D.C. Kristin is a member of the National Capital ONS Chapter, and it currently serves as the treasurer on the ONS Board of Directors. Welcome, Kristin.
Thanks so much, Laura. I'm really excited to be here and excited to talk with you today about the future of oncology nursing.
Great. And lastly, we have ONS member Ashley Leak Bryant. Ashley is an associate professor and researcher at the University of North Carolina School of Nursing. She is a member of the North Carolina Triangle Chapter, and Dr. Bryant is a previous chair of ONS's Leadership Development Committee. Thanks for joining us today, Ashley.
Thank you, Laura. I'm glad to be here.
It's just been a pleasure to work with each of you, and I'm excited to share this podcast with you. So let's talk about the future. You know, when our project team met last summer and we all looked into our crystal ball, we didn't see some of these earth-shattering changes that we've seen in the past 6 months. We didn't appreciate the devastation that would be caused by a worldwide pandemic. We didn't realize the dramatic economic impact that would follow. And many people didn't recognize the extent of systemic racism in our country. But we knew that key trends would influence and change the future of cancer care. We knew that oncology nurses would need new knowledge, skills, and competencies to care for people with cancer in the future. So let's have a conversation about that project team and our outcomes and what some of those trends were, and especially how those trends have been accelerated and maybe are already present in our clinical practice. So just to recap, our project team identified 6 major trends that we thought would affect oncology nursing. And those trends included things like value-based care, technology, educational changes, emerging science, changes in relationships, and changes in oncology roles. So our panel members today have expertise in each of these areas. And so let me first call upon Anne. Anne, what opportunities do you see for oncology nurses related to value-based care and technology? And when you answer that question, talk a little bit about how you've already seen those trends playing out under the current pandemic.
Thanks, Laura, and it's just a pleasure to be here with all of you today. As oncology nurses, we are really integral to value-based care. Our roles as coordinators and navigators for our patients and families put us in the center of ensuring better care, both at the individual and population levels. Our focus on education and ensuring our patients know what to anticipate throughout their cancer journey impacts the cost of care in many ways. Prepared patients can often prevent or anticipate side effects or toxicities, so we can manage them early, avoiding unplanned office visits and admissions. These actions by the oncology nurse add significant value. The role of the primary nurses and oncology nurse navigators that practice in oncology settings are the glue of the system for our patients and their families, even before the pandemic, but in the midst of COVID-19, even more so, with the significant uptick in our ability to deliver telehealth. Regarding technology, wow, there is so much going on in that space. I think we've mostly now adjusted to having electronic health records in our practices, but now we are seeing so many options for apps designed to help monitor symptoms and provide guidance to our patients, apps to enhance medication compliance, especially for our patients on oral treatments, mobile patient-reported outcome products, and physiologic monitoring capabilities, to name a few. These have all become such incredibly valuable tools to support our patients in the midst of COVID, and I'm fairly confident will quickly become much more mainstream.
Thanks, Anne. I think we're going to revisit this topic of nurse coordination and nurse navigation. And I suspect that Kristin will talk a little bit more about that because of her own experiences as well. The technology is clearly an issue and a concern in the time of the pandemic and is a source of potential disparities in terms of the healthcare disparities that we're seeing playing out, in part, I think, because of access to the technology. So while I agree with you, Anne, that we've certainly seen a significant uptake in the use of technology, it really only works for people who have access to that. And I wondered if you could talk just a minute or two about what you're seeing in your own practice in that regard.
Absolutely, Laura. I mean, certainly in my role as the executive director for community practice sites that are all over Southern California, we have practices in communities where people have broadband and good internet, and then have other community practice sites in areas where people might not even have a computer in their homes. And so the ability to really leverage that technology and have it benefit everybody equally is really compromised by some of those disparities that we absolutely know exist. And until we really get to a place where everybody has access to some minimal standard, I think we're going to continue to be faced with challenges for all of our patients having the same level of quality of care. And in many of our small community practice sites, we continue to rely specifically on the good old telephone, where the nurses or the doctors are calling patients and focusing on assisting them and guiding them using a technology that pretty much everybody does currently have in their homes.
Wonderful. Well, let me turn now to Ashley. And as a fellow educator, Ashley, I know that you've seen major changes happening in the world of education, not just in the academic world, but also in the continuing education world, and that you've also seen as a researcher changes in terms of emerging science that is true in healthcare and oncology nursing. So I wondered, as you've thought about those trends, what excites you about what you've seen? And how do you think ONS can help prepare future oncology nurses for those changes?
Well, thank you so much, Laura, for that question. And as a fellow educator, I must say that there are endless opportunities of possibilities in oncology nursing education. And I think the pandemic has helped us to see the value, the importance, and how social media technology can help us deliver high quality education to our students. ONS offers a free ONS Basics course, in which I think is a great opportunity for nursing students to enroll in this course and really understand the pathophysiology of cancer and the different trends that are happening. There's also a course for undergraduate students, and I believe that's for a small nominal fee, but that's another great opportunity in which people can infuse that course into their undergraduate curriculum. There's changes in how we deliver education, and I mentioned that of these hybrid models in which at times we may need to come face to face, in which we physically distance and we wear a mask. But I would say majority of education, I would say currently that's happening right now is virtual. And I want to give you one example here. So we're in our 5th year of our oncology nursing fellowship program that has been sponsored by generous donors. It was first started by Susan Flynn Oncology Fellowship, and that was by Fred Flynn, whose wife died of ovarian cancer. And we've continued to receive funding support from 2 generous donors at North Carolina Cancer Hospital. And so this is a clinical fellowship for undergraduate nursing students during the summer. It's usually a 6-week course, in which they're working with nurses for 32 hours a week. And so with the pandemic that is currently happening, we had to really transition that clinical face-to-face experience to something that was completely virtual. And so we had to really think about how can we deliver this in a virtual simulation. We had the students join ONS and enroll in the pre-ONS basics course. We had the donors speak about their experiences as caregivers. We had the students also connect with patients and caregivers who are undergoing treatment for them to really have that conversation of what it's like to be diagnosed with cancer and to move through the journey. And so this is one example in which we've had to really rethink our program and then think about how does the student then deliver this information learned over the summer in a way it shows that they have learned something about this content area. And we did that via Zoom, and that worked wonders. And people were really able to attend. I would say more people were able to attend than what we've had in our face-to-face kind of graduation celebrations for these students. I also would say in education, there is a huge focus, and Laura, you mentioned this, and as well as Anne, about caring for racially and ethnically diverse groups of survivors and families with even various languages and cultures. And so it's important to make sure that our students are fully aware of how to care for people across the continuum, but also who may look different than you. As a researcher, I must say that it's critical to ensure that our research is grounded and rooted in the problem and that we really have stakeholders on our teams. That includes those who may be suffering from the disease and to get their input and buy-in for the work that we're doing. I think for our research to really be sustainable and for us to really make some strides in implementing this work for future dissemination in practical settings, particularly the outpatient ambulatory settings, we need to make sure that the people who are experiencing this problem have been and will be involved in the process of the design of the study. So thank you.
Thank you, Ashley. You've brought up some really great points. And as our project team met and talked about education in particular, I think we didn't anticipate the speed at which people would move to online education. I think, as ONS members, we've become very comfortable in using things like podcasts and online courses to learn. And with the ONS Bridge, we're going to have an opportunity to have our first virtual conference offered online completely. But I think the shift to online has created challenges for educators to look at how can we engage our learners and how can we continue to evaluate the impact of our learning. I know in my own education setting, one of the challenges that we're trying to deal with is how do we engage students in simulation activities where they can learn perhaps in a simulated environment and not be placed in a clinical environment where they may be at higher risk, or that as students coming into a clinical setting, they may be exposing potential patients and others to virus that perhaps would not be present if the students weren't present in the clinical environment. So I think as we look forward to a future, one of the things that we pray and hope for is a resolution to the current virus and the current pandemic. But there's also the recognition that future pandemics may be a part of our reality, and that we will need to take what we've learned in this experience of how do we educate future practitioners and future learners through online and electronic capacities in a way that is completely different than what we have been accustomed to now. And I think the research points that you made were really valid. And as we begin to look at how do we do research in a time when it's perhaps more challenging to have direct engagement with participants in our research, with either patients or caregivers or family members, just because of the limitations of access to those individuals, we're going to continue to struggle with that for a bit, is the sense that I have in working with my researchers. Ashley, do you have any other thoughts?
Yes, so I would say also, just to add to that nurses are lifelong learners, right? And ONS has been a huge supporter of ensuring that we have the necessary tools to ensure that we have the continuing education. And I think ONS Bridge is one example of ONS bringing high, innovative, cutting edge sessions in which nurses from all over are able to attend and really be able to make changes within their clinical environments. And so we all want to improve healthcare outcomes for our patients with cancer and their families. And so I would say continue to look at your ONS weekly news and the clinical updates, because that's going to be another way in which you can really keep up with what's happening and all the emerging changes, but also the journals. So, we have the Clinical Journal of Oncology Nursing Forum, and other journals that are cancer specific, but also education specific. So I would encourage you to really look at those resources and to share those resources. So after you have finished reading an article or that journal, to leave it, there on the unit, so others will be able to have that opportunity to look at that and potentially a journal club or a lunch and learn in the future. So I think that's important for us to continue to educate ourselves even more and share what we learn with each other.
Wonderful. Thank you, Ashley. So, Kristin, I know you've worn many hats as an oncology nurse. What trends do you see in terms of the changing relationships of oncology nurses with other members of the healthcare team that we might continue to see amplified in the future? And what kinds of new roles do you think we'll see for oncology nurses?
Thanks, Laura. First, let me just say I really appreciated the chance to work on the Future of Oncology Nursing program with ONS and getting to speak with you today about my thoughts. I think you're asking a great question. One role we've seen grow a lot in the last decade has been nursing roles in healthcare informatics. Many new and innovative ideas about how to care for patients and improve the care we currently provide are being created by nurses who are harnessing technology to benefit people, both patients and the nurses that take care of them. As technology, like Anne discussed, continues to integrate more and more in healthcare, I believe we'll see nurses who use technology more and more to evaluate and treat patients. For example, the wearable health devices that Anne was mentioning, such as an Apple Watch or a Fitbit. A lot of people have them right now, and more people are getting them every year. And right now, when people wear those, a robot in the program tells us, or the people that are wearing them, recommendations based on the data that's being collected. For example, whether that data is a person's weight or their heart rate during physical activity, or maybe their diet that they're entering. But in the future, will we see nurses who are working for companies like Apple or Google and perhaps providing real-time, on-demand health coaching? Will health coach nurses perhaps be a new field that's developed? And will they integrate into technology fields and be able to give that real-time coaching that, may combine a motivational speaker aspect that's needed for changing a person's health habits, as well as evaluating the health data that's needed with a clinical eye? I believe that a nurse could fill that role. Currently, nurses work in large interdisciplinary teams often in order to treat people with cancer. In the roles I've worked in, nursing input is highly valued as other health team members know that nurses are the healthcare role that usually spends the most time with patients, whether that is at the bedside as an inpatient nurse administering medication and other treatments, or as an outpatient nurse navigator, speaking to patients over the phone weekly, sometimes daily, and discussing with them how to manage their side effects for treatment or educating them on the next phase of their recommended care. Nurses often connect the dots for cancer patients, either between different specialties such as medical oncology, surgical oncology, radiation oncology, dietary, but also through the cancer trajectory from diagnosis to remission or end of life. I believe we will continue to see this trend moving forward, as it will take time for our healthcare system, which as we know is very fragmented, to communicate easier between the many healthcare institutions, specialties, and EHRs that we have. However, with the current pandemic bringing more attention to the nursing profession and the large role we play in coordinating care for patients and administering treatments, I believe there will be more opportunity for roles that were traditionally filled only by administratively trained staff or physicians to be filled by nurses who are more than qualified to lead healthcare systems.
Kristin, those roles sound very exciting and things that new nurses that Ashley and I work with as students can absolutely look forward to, as well as practicing oncology nurses who may be looking at a new role and may realize that the roles that they will serve in the future perhaps haven't even been invented yet. And that's an exciting part. So looking down the road 10 years from now really seemed like a daunting kind of feature, but One of the things that the ONS board had to deal with is that they need to develop a strategic plan around at least the next 3 years that will help us get to that future vision. And I know that Anne and Kristin, you are continuing as ONS board members, and I wondered if you could spend a few minutes talking about ONS's strategy for supporting oncology nurses from now until 2029, at least for the next 3 years. Anne, you want to kick it off?
Thank you, Laura. So exciting to hear Kristin talking about new roles and knowing that there's so much within arm's reach at this point. Certainly one of the things as a board member and for the board, we commissioned this work because we really knew that we needed to begin to think about how to prepare our members as well as our society, our Oncology Nursing Society, for the future. So we've taken the work of the think tank and leveraged a lot of the topics and the conversations into our strategic priority document, as you were mentioning, Laura. So for the short term, in the next 3 years, we've really identified 4 strategic priorities. And those include continuing to elevate nursing practice to ensure the delivery of quality cancer care, to really continue to stimulate a culture of innovation. I think a term that oftentimes as nurses in the past we haven't felt ourselves involved in, but knowing now that there's really great opportunities for us to drive change through innovation. The third strategic priority, to strengthen the voice of oncology nursing and continuing to ensure that we are advocating for our patients as well as for the general population and being involved in health policy. And fourthly, continuing to ensure that as an oncology nursing society, we remain both an effective and efficient organization by keeping an eye on the future. And certainly a part of this task force was focused on that and ensuring that we are paying attention to what we're calling the signals and what are the things that are happening in the future. So those were kind of really the 4 things that as a board, we've now embedded into our strategic priorities. And I'll let Kristin expand on that a little bit and add her thoughts.
Thanks, Anne. Yeah, within these priorities, ONS calls out actions around partnerships, monitoring for trends, leveraging intellectual property, and driving towards innovation. All of these arose out of the work that the think tank and the recommendations made to support our vision to lead in the transformation of cancer care. I do think it's very important to know that ONS's first priority overall is to be a professional home for oncology nurses and a place for them to network, whether it is in person at events like ONS Congress every year or virtually through the ONS communities where nurses can post questions and other nurses who are members can respond, or through the upcoming virtual conference, ONS Bridge. I know that ONS staff members look closely at what questions or concerns our members are posting about in the ONS communities to see how we as an organization can tailor resources to meet the needs of oncology nurses as they develop. In addition to being a trusted resource of educational information, for any experience level, from a new oncology nurse learning to give chemo to an experienced infusion nurse who has a question about a new drug, ONS wants to help nurses grow in their leadership skills in different ways. By having the opportunities to be a local ONS chapter leader in many areas of the country, ONS also helps nurses learn how to lead other nurses, as well as become experienced in avenues that may not always be seen in many traditional nursing roles, such as learning about fiduciary responsibility and budgeting of an organization, program planning, and other types of mentorship opportunities. So overall, ONS is going to continue to adapt, change, and grow as healthcare develops in order to match the needs of our members and how we can best serve them. And this think tank that all of us were members of really did help to identify, as Anne was saying, certain trends that we do think that are going to be appearing in the next decade in healthcare and will help us stay up to date as an organization for our members.
And Kristin, where would an ONS member find out more about what's happening with the strategic plan for ONS? How would we know what's happening and what has actually been achieved by ONS relative to that strategic plan?
Well, Laura, the ONS voice emails that come out weekly often detail updates about the strategic plan and what the board is working on. And of course, the ONS website, you can go and online at the ons.org and view the strategic plan, and it's updated as updates occur.
Thanks. Ashley, I was thinking you mentioned some ONS resources when you were talking about education and research, but are there things that ONS has that helps members deal with the amount of change that we're seeing? Because, in fact, the future is all about change. And while there are some things that will look similar to what we're doing today, more will likely have changed than will be the same. And so, are there any resources that you're aware of that ONS has to help oncology nurses and support them as they navigate these changes?
Yeah, so I think ONS has several resources. And so I would encourage those who are listening to this podcast to go to the www.ons.org website. And there are different tabs in which you could really explore the needs of potentially of your institution. So looking at local policies of things that you may be interested in understanding of what's happening at your institution, but also the national policies as well. So I think the website will definitely give you information there. I would also say resources, we have each other. And I think we sometimes forget that our own coworkers, our colleagues, our peers, even in a different discipline, they oftentimes may know some information that has not been shared with everyone widely in our clinical area. But that's where I think the ongoing either weekly update in which information is shared or a new tip or new evidence that's come out that's important for everyone to know, I would say is an important resource. So let's not forget about each other.
Really good point, Ashley. I completely agree. I know one of the resources that ONS currently has on the website that I have found particularly helpful is a self-care library. I don't know if the rest of you have found this little gem, but it's on our website currently, and it is available for anyone to see, not just oncology nurses, but really anybody who visits our websites. If you look under the learning libraries and specifically look up self-care, there are lots of strategies and tips and apps to help people really deal with the amount of change that is happening in their world. And I think those skills will be an important competency for oncology nurses in the future, remembering to care for ourselves first so that we can continue to serve the people that we care about. So this has been a great conversation, and I have a question that I'd like to have each of us respond to. And as we're getting ready to wrap up our podcast, what's something about the future of oncology and oncology nursing that you think isn't often discussed, but you wish people knew more about? What haven't we talked about? And I'll start with you, Anne.
Thanks, Laura. Yeah, sometimes the things we don't talk about are the things that are actually we should be talking about, the good old elephant in the room. One of the things that comes to mind as we talk about this today is, and as I think about my more than 35-year career in oncology nursing, is I wish we would talk more about primary prevention and our role as oncology nurses in actually preventing cancer. And I'm really hopeful that as the future unfolds, we find ourselves with the opportunity to be in the center of supporting people in our communities in maintaining their health, rather than so much time treating people with a cancer diagnosis. And I really see as the future unfolds and with the technologies and the informatics that Kristin was talking about and our role in that we really can kind of get ahead of the curve, if you will, and spend more of our time as oncology nurses really helping to teach our communities how to maintain their health.
Good point. Kristin.
Yeah, thanks, Laura. I believe that the science behind how cancer is identified and how tumor markers are being used to determine treatment options more and more, this science is accelerating rapidly. So many new drugs for specific genomic profiles are being developed and coming to market. It's very exciting, but it can be daunting to a new oncology nurse or even a nurse who's been an oncology nurse for decades. I believe that while care is becoming more and more specialized, it will be really interesting to see where oncology care model groupings go. For example, will there continue to be breast cancer nurse navigators and hematology nurse navigators? Or will we have nurse navigators grouped by the genes expressed on a cancer profile? Because that nurse will be better educated about the drugs that can be used to treat it and the symptoms that may need to be managed. In general, we see healthcare becoming more specialized, and I believe we are going to continue seeing this trend evolve rapidly in oncology. It's becoming harder to remain a general oncology nurse, if you will, and more people I see identify with being a specific type of oncology nurse. For example, an infusion nurse or a radiation oncology nurse. Patients very much benefit when nurses know the science behind how cancer is identified and treated. So I believe we will continue to see a high demand for education among oncology nurses who focus on particular points of contact for patients in their cancer journey. I also really hope that more science is developed on how to prevent cancer and specific causes of cancer. As you'll see in our ONS Bridge session, we have 4 potential future world scenarios. And in one of those scenarios, a chip in our arm can help detect if we are developing a cancer. And while this may seem very outlandish, several decades ago, cell phones were non-existent, and now nobody can live without them. So I would never say never. And the role that all nurses play in prevention of illness and disease and health promotion, I hope will continue to grow, and I think will be very much needed in the future.
Really good points, Kristin. Ashley, what did we not talk about that you think our members should know about the future of oncology nursing and what we can look forward to for 2029?
Sure. So I think one area that sometimes is not discussed is the global oncology needs that are often unmet. So ensuring that we are equipping nurses globally to care for patients and their families with cancer. So really building and increasing their workforce capacity, ensuring that they have the best and up-to-date clinical practice guidelines that's relevant to their country, and continuing to build these partnerships and collaborative initiatives to improve patient outcomes.
Great. As I thought about this particular question, I was thinking about the Institute of Medicine, the National Academy of Medicine's Future of Nursing report. The new report for 2030 was to come out the end of this year, but they've delayed based on what we've learned because of the pandemic. And I suspect that the ONS board and leadership, as you continue to work with the strategic plan and think about what the future of oncology nursing will look like in 2029, will be informed by what we've learned just in this year and perhaps into the next couple of years. And I think one of the major points that struck me is the importance of making change at the policy level, and that oncology nurses will need to not only be aware and be informed and educated about what needs to change, but also to be actively involved in the change process. And for many of the problems that we are currently experiencing, whether that's from access to care issue, whether it's the impact of climate change, whether it's changes in terms of structural racism, all of those are going to likely require policy changes. And so to the degree that ONS can continue to be supportive of oncology nurses being engaged in their local and state and federal policy decisions, I hope that we can look forward to that piece as well. So in closing, let me put our panel on the spot and ask each of you, what's one thing that you would want the oncology nurse of 2029 to know? And I'll start with Anne. What would you want an oncology nurse to know in 2029?
Thanks, Laura. Yeah, I guess I would say to an oncology nurse in 2029 that it will remain the best profession, that it will continue to be just such an incredibly important and meaningful profession with really significantly expanded role opportunities. Kristin shared some of her thoughts around that. I mean, with nurses as health coaches, and when we talked about our future worlds during our work, we participated in really envisioning exciting new roles for oncology nurses. Kind of made up some terminology for some of them, that we might have nurse talent developers or oncology treatment advisors and directors of virtual care. And, if you join us for our ONS Bridge session in mid-September, you'll hear us talk about some of these potential futures and potential opportunities. And I would say that for that nurse in 2029, he or she needs to be prepared with knowledge and skills to provide quality cancer care. And as the Oncology Nursing Society, our goal is to ensure that to provide you with the standards, the tools, and the products that you will need to do so. And actually, as we were preparing this week, our first 2 ONS guidelines were published to our website. And so it just speaks to the mission and the vision of the organization to ensure that we continue to make products and tools to support oncology nurses in caring for patients.
Fabulous. Kristin, what's one thing that you would want an oncology nurse to know in 2029?
I would want an oncology nurse in 2029 to know how hard it was to read physician handwriting back when charts were not electronic at all.
That's great.
Because that's something that they'll never experience. But seriously, I would want a future oncology nurse to know how much networking and meeting other oncology nurses, both in person and virtually, is important to career growth. When I see all of the information available now through podcasts and emails and webinars, and there's just a plethora of information, it still doesn't take the place of meeting people and learning about information firsthand, their experiences, and bouncing off ideas off of nurses that you've met at a conference or online in a virtual community. I know it's been a really positive influence in my career and given me a lot of satisfaction. And I think that it will continue to be a way that we might not realize, but that we end up learning some of the most important things from in our career. And I would want to encourage networking as a way to grow and learn new information.
Fabulous. Ashley, what's one thing that you would want an oncology nurse to know in 2029?
So in 2029, I want you to know that you are a leader, you are an educator, and you are an advocate. Continue to make sure that you lead and be a change agent in your environment. We need nurses who are able to make policy changes and who are going to be able to make things different in 2029 than what they are now.
Fabulous. And I guess what I would want nurses to know is the value of an ONS membership, and that ONS will be here for you in the future, just as we've been for more than 40 years for our members. And so I would just want to thank each of you for participating in this podcast. I thought that this podcast is really a teaser for our session at the ONS Bridge, and I hope that many people who are listening will have a chance to participate in our session at the Bridge meeting. And so I'll see you in our virtual session. Thanks, everyone.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you download your podcasts. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org.